I was able to return to working from home on February 12th. I felt really good about that. I was anxious to return to a normal life. Unfortunately, my body wasn't ready to take me there, not just yet. From the start of this, I had had trouble sleeping because I couldn't breathe very well. I felt like there was pressure on my chest when I laid down, and that caused anxiety, and all that meant I could barely sleep. For a few weeks, I was trying to go back to work and continue to heal on about an hour of sleep per night. I spent my nights watching TV in a recliner downstairs so Monique could sleep. I was a zombie. It was really rough. It was terrible for Monique as well. Remember how this started? I couldn't sleep. I got up in the night to go downstairs, then I collapsed. She was terrified that it was happening again, night after night. I finally had enough. On February 22nd, we went back to the ER primarily for the sleep problems, and they diagnosed me as having congestive heart failure, essentially fluid in my chest. They prescribed medicine that seemed to help quite a bit with the fluids and sent me home at 4 a.m. on February 23rd. Then around dinner time on March 1st, I suddenly got very sick. I was pale, clammy, and nauseous. My blood pressure was extremely high, and my pulse was wildly erratic. The doctors quickly determined that the issue was atrial fibrillation. All the doctors had known I had AFib since January, maybe even before, but my cardiologist didn't see that I had any real symptoms for it, so he didn't address it earlier. I was definitely having symptoms by this point. And so I spent another 5 days in the hospital. I was on countless medicines, more than 15 pills just in the morning, to address the AFib and congestive heart failure, and of course the diabetes as well. So, if you received some nice dividends from your CVS stock last quarter, you're welcome. The cardiologist determined that I needed a procedure called a cardioversion, which is where they shock your heart back into normal rhythm like they do on TV. Clear, zap, clear, zap. On March 4th, I had the cardioversion and it reset my heart to a normal rhythm. I was under anesthesia at the time, so I remember nothing. All I felt afterwards was a slight burning on my chest like a sunburn. I remember thinking before they began the cardioversion that I wanted to hold a bag of popcorn while they did it and see if any of it would pop. The doctors were making jokes and having a good time before they started the process, so they probably would have got a kick out of that idea. Believe it or not, the worst part of the cardioversion was removing all the stickers and shock pads that were stuck in the hair on my chest and back. That hurt. I actually had a nurse quit working on me and leave because I was literally screaming. She felt like she was torturing me, and frankly, she was. Just a tip. If you have hair on your chest or back, shave it off before you have this procedure. I was released from the rehabilitation hospital on March 6th. The fun continued on March 7th, when I had to return to the ER. I had swelling and pain in one forearm where I had an IV, and I was concerned that I had some kind of blood infection. That turned out to be a small clot in the vein, which ultimately went away on its own. And I was home for a few weeks. The AFib was behaving, all the blood tests were better, so it seemed like the worst of this was behind me, right? No. The cardiologist had determined that I had a blockage in the heart. On April 11th, I went in for an angiogram where they inject you with chemicals that allow them to look around inside you. They determined that I had significant blockages and required heart surgery. You can imagine that I was pretty upset. It felt like I keep overcoming one hurdle only to find 3 new ones in front of me. Endless shots and blood tests and IVs, and I really, really hate needles. And now, heart surgery. The worst thing yet. Truthfully, if it weren't for my wife and son, I would probably have declined the angiogram or at least delayed it for a while. And I almost certainly would decline the heart surgery, at least for now. Why? This has gone on for weeks and weeks now, with no end in sight. I'm still dealing with periodic memory problems, stress, depression, fear. Yeah, if it were just me, I would probably not do this surgery. But there's Monique and Ryan to consider, and my brothers, and nieces and nephews, and so I press on. On April 24th, I met with the surgeon and got more information than I wanted. The surgeon told me, in your typical direct, blunt doctor way, that I require open-heart surgery for 4 blockages and possibly a heart valve replacement. Probably a heart ablation while they're in there. Why not? I have been reeling since then, terrified and demoralized and upset. Now I wish I hadn't watched all those shows on Jack the Ripper. Remember the chestburster scene from the movie Alien? Yeah, I'm getting some wonderful mental images from that one too. Recently, Monique brought home a baked chicken and picked all the meat off of it. I stood there looking at the rib-exposed carcass on the counter thinking, yeah, little buddy, my turn next. I see it in my dreams. I catch myself dwelling on it while I work. I can't think of much else. I really wish I was exaggerating about how I feel right now, but I'm not. I'm told my chances of survival from the procedure are very high, like 97 to 99%. Not sure I believe those percentages, by the way. But they've got to gut me like a fish to do it. There are aspects of this procedure that I literally can't even bring myself to verbalize right now, and I'm going to walk into the hospital and let them do all that to me. But wait, it gets worse. From what I understand, I'm only in the hospital for a few days. Then I get to go home and heal for a month on my own. I can't even ride in the front seat of a car for a month because a deployed airbag could kill me. I've got 2 cats and a dog that love to jump on my chest. Going home so quickly fills me with no confidence whatsoever. I try to remember that I've been fortunate in some ways. Thankfully, my insurance has taken good care of me, to the best of my knowledge at least. I met my deductible for the year by the end of February, so I don't pay anything to go to the doctor or get medicines until next January. Oh, that's good, but it's a tough way to save money on pills. I think all in all, I'd rather just clip coupons. I've received wonderful support from Monique. She really has been awesome about taking care of me. How many hours and days she spent talking to doctors and nurses. How many nights she slept on a crummy sofa in my hospital room to be there for me. How many times she drove back and forth from home to the hospital to take care of her mother and then come back for me. It was just remarkable. My boss has also been extremely supportive and helpful, and the team of writers I work with has stepped up to fill the gap while I'm not there. Monique's brother Bill and his wife Frida, and our friends Belinda, Brenda, Sean, and Terry, Monique's minister Katie, they all stopped by to check on me in the early days of this nightmare. I hope I didn't leave anyone out, but as I said, I wasn't always there mentally, and the short-term memory is still finding its way back. And I took great heart, no pun intended, in the dozens and dozens of posts from people all around the U.S. who offered their prayers and best wishes. People I haven't seen in 40 years in some cases. High school even. I've even received very supportive messages from both of my ex-wives. Imagine that, huh? There are many times when I was feeling very low, and the flood of responses I received was very helpful and encouraging. So far in 2024, I've lost 40 pounds in 2 pant sizes, and it's only mid-April. I anticipate that I will lose more. This is not what I wanted for a diet program, however. This reminds me of an old joke. 2 mutes, Bill and Ted, were friends who sat together at the park every day. Suddenly, Bill stops showing up. For weeks, no sign of Bill, and Ted is sick with worry. Then one day, Bill walks up to Ted in the park. "Where have you been?" Ted signs frantically. Bill suddenly begins to speak. "Stop. I can speak now, Ted." "How did this happen?" Ted signs. Bill says, "I went to a special therapy. It was very, very difficult, but it worked and now I can talk." "I want this," begs Ted. "Tell me what to do." Bill looks reluctant. "This is really tough therapy," he said. "I don't know if I want to be responsible for you going through it." "Anything," signs Ted. "Tell me what to do." Finally, Bill relents and gives the doctor's address to Ted. Ted rushes to the doctor's office, bursts into the door and signs, "I want to talk." The man behind the front desk says, "I must warn you, this therapy is effective, but it's very difficult." "I don't care," signs Ted. "I'll do anything." The man stands up and leads Ted to a treatment room. They go in the room, close the door, and the man says, "First, please undress completely." "Undress?" signs Ted. "Why do I undress for speech therapy?" "You must follow my instructions if you want this to work," says the man. "Please undress completely." Ted takes off all of his clothes. Then the man says, "I need you to get up on the table on your hands and knees." Ted is perplexed, but he does what he's told, butt naked on his hands and knees on the table. The man goes to the corner of the room, grabs a broomstick, walks up to Ted, and rams the stick right up Ted's butt. "Ah!" screams Ted. "Very good," said the man. "That was the letter A. Come back tomorrow and we'll work on the letter B." The moral of this story is, I've lost 40 pounds, but I'm not sure that was worth what I went through to do it.